Hi, thank you for this opportunity. My name is Timy Kim. I'm a senior solution engineer with Daon. Daon can help simplify your patient intake and check-in process so you can put the focus back on delivering quality care in a timely manner. Nowadays, more than ever, patients are accessing digital health services, including telehealth and e-prescriptions. Due to the increase of online services rendering different modalities of care, hackers and fraudsters will look for a weak point to penetrate. Healthcare payers and providers trust Daon Identity Assurance to help connect patients with the critical health services they need on the ground, in an app, and on the web. Part of the critical need of having patient authentication is to mitigate the risk of both fraud and human error with biometric onboarding and authentication solutions. Patient authentication can be your face, finger, or even your voice. This will save you from needing to remember lengthy or complex passwords that sometimes become a frustration point when trying to access your patient portal. Some benefits of patient authentications are reduction to a fraudulent medical and insurance claim, improve patient care and reduce costs, ability to transfer and exchange health records. For example, you can implement a step-up process here to have the patient authenticate with their face and voice or any other biometric combination you desire for such a high-risk request to ensure it is indeed the patient and not a bad actor who is attempting to exploit a health record. The Daon Identity X platform can be hosted or offered on-prem. We also have a SaaS offering. In this illustration here, you'll see that a patient can create their account or start the process online and transfer and move forward with the process on their mobile device. Taking a selfie uses an algorithm, a passive liveness algorithm, to ensure that it is a live individual that is capturing the image of themselves and not placing a video or photo in front of their video camera. What we're also able to do here is capture an ID document such as a driver license. So as the process steps forward using the mobile device, you'll also be able to have a seamless journey from onboarding to cross-channel authentication, where now you've onboarded, you may also use the authentication to access the patient portal. So why choose Daon? We're FIDO certified as well as ISO 27001 and 27018 compliant, as well as SOC 2. In regards to privacy, we're GDPR and CCPA compliant. Before I demonstrate a portion of our Identity X solution, I would like to end off by saying Daon is here to help you make the connections you need through any medium with total confidence, enabling safer, more integrated health services on all fronts. Whether it's online, mobile, or in the contact call center, we have an identity and authentication solution that is right for you. Daon is trusted by leading global brands across various industries. Now I would like to go ahead and begin the demonstration. The scenario I'm demoing here is you have a patient who's ready to apply now or create an account to access their patient portal. This experience is initially started on a web browser where the patient is using their laptop or tablet of some sort. What you're presented with here are the steps that that the patient will be encountering during the onboarding process. Again, this is an example of what the steps or the sequence may appear like. You'll first be asking for consent, and then the onboarding process will move to your mobile device where you'll then take a selfie and then complete your document capture of your driver license or US passport. As I mentioned, Daon is GDPR and CCPA compliant. The instructions here are simply letting the patient know that they will be using their mobile device and scanning the QR code to continue on the onboarding. Now that the onboarding has moved to the mobile device, you'll be able to go ahead and get started. We have videos that are explaining what the process will entail. Here, you'll have to allow the use of the camera. So what happened there is my face was needing to be detected in the oval. There are algorithms that are detecting the liveness and ensuring that I am indeed a live person and not a video or photo that is being presented to the onboarding. So you can then catch if there's any potential fraudster here who's attempting to use someone else's video, face of someone else's video of someone else's face, or an image of someone else on a phone and trying to hold it to the camera here. So there's the passive liveness algorithms that are running any of the checks against that and spoofing, as well as quality of the images to ensure that it's clear and it's not blurry and there's enough lighting. So what I'm doing now, I will be selecting that I'm using a driver license. Again, we have video instructions here explaining what this step will entail. So now that I've captured the front of my driver license, I'm now also asked to provide an image of the back. And that there is really the onboarding process there of obtaining the selfie of the patient and verifying that it is a live individual that is processing or creating this account. Thank you again for your time. If you have any further questions, please reach out to us. Also, please visit our website for additional information.